right, we appreciate everybody being here. We did decide from suggestions from you in support groups and in programs like this to kind of start over at the first of the year and go through and do these 30-minute programs and doing a deep dive into each of the most common types of dementia. We did talk about Alzheimer's disease last week. We did a 30-minute program. If you missed that and you're interested, Jamie, that is on our YouTube page. Is that correct? You can get to it on our YouTube page.
It will be this week.
It will be on our YouTube page where all of our programs are that we record. We record all of our educational programs. We never record support groups, but we do record these, we call them our bite-sized education programs. So we will get started. And like Jamie said, you'll get these slides this afternoon. So let me share my screen. And let me make my screen big where you can see it. There we go. Did that work, Jamie? Perfect. So first thing, what is vascular dementia? You may have heard that term before, and it's the one that it's exactly what it sounds like, vascular. It has to do with the cardiovascular system. And it's a decline in skills that's caused by reduction of blood flow to various regions of the brain, depriving them of oxygen and nutrients. So anything that happens that deprives the body of blood flow to the oxygen, the narrowing of the vessels. So anything that is bad for the heart is bad for the brain. If it's good for the heart, it's good for the brain. That's one of those things to kind of keep in the back of our mind all the time. Because lots of times with this vascular dementia, as we're going to see here, this is subtle. It's years of damage before finally there's the stroke or there's the heart attack. And so somebody can be developing vascular dementia over the course of years, and sometimes we're not putting two and two together as to what's taking place with them. So what's happening is that inadequate blood flow damages and eventually is killing the cells in the brain and can be very subtle. It is the only dementia that can have a sudden occurrence due to a stroke that blocks the blood vessels in the brain. So all of the other dementias, they come on over time. And this one can as well, like I said, but it can also, it's the only one where they didn't have it and then they do because they either had a stroke. Sometimes we'll hear this after someone has had general anesthesia. The family will say it's like they woke up out of that, from that surgery and they had dementia. Well, and as we talk to them, we find out that there were some subtle signs, but the family maybe didn't know that those were signs of vascular dementia. But then they went and had general anesthesia being the #1 accelerator of the disease. And they did come out from under that general anesthesia. And it was like they just all of a sudden developed dementia. So some of the things, again, with what is vascular dementia. These thinking difficulties may also begin as mild changes that worsen over time as a result of minor strokes. And you may have heard that word or this term TIA. A TIA is a small stroke. People can have TIAs and not even know that they're having them. And then they go and they have, and we're going to talk about diagnosis. They'll have an MRI and the doctor can actually see. Sometimes they call them pinpoint strokes because on an MRI, they just look like little teeny tiny pinpoints. They can even be so small that they can't see them. I've had families bring me in and show me MRIs of people who've had hundreds of TIAs. So people can be having these TIAs for years. There's also other conditions that affect smaller blood vessels. And you'll hear this if somebody has had these multiple strokes. You may have heard the term multi-infarct dementia. They used to use this term for vascular dementia all the time. That was the only word they used, was multi-infarct dementia. But now we hear more of the term vascular dementia. And I know in some of our support groups, people will talk about their loved one was diagnosed maybe in the early 2000s with multi-infarct dementia. That is vascular dementia. But when they do specifically call it the multi-infarct dementia, Typically, that means that they have had multiple strokes, multiple TIAs. So anything that is affecting the cardiovascular system, and sometimes we don't think of things like diabetes. Diabetes is affecting cardiovascular system. Smoking is most definitely affecting our cardiovascular system, but it's over a long period of time. Hypertension or uncontrolled high blood pressure, keeping in mind that these are things that are not controlled. If it is controlled diabetes, if it is controlled hypertension, that's completely different. But people live for years. You'll hear hypertension called the silent killer all the time, where people don't even realize that they have high blood. Cholesterol is another one. Somebody who is obese. And then depression. And I did some research into depression and vascular dementia yesterday, and I've got an entire slide on that we'll look at. Vascular dementia is also the one that very often coexists with other dementias. So somebody can have what's called a dual diagnosis or a mixed diagnosis, where they have Alzheimer's disease and vascular, or they may call it vascular with Alzheimer's disease. Typically, whichever one presents itself first is the one that they will list first on a diagnosis. So they may say they have vascular dementia with Lewy bodies. That just means that they were diagnosed with the vascular dementia first. It also often coexists with depression. There, that pops up again. And again, we're going to talk more about depression and vascular dementia in a minute. These cognitive symptoms tend to develop gradually when the underlying cause is a chronic blood vessel problem, such as diabetes, the high blood pressure, cholesterol, any of those others that we discussed. It will come on so gradually that so many times the family does not even realize that this is a link to dementia. Because what's happening is that very slowly the narrowing of the blood vessels is taking place, and it's progressively depriving the brain tissue of oxygen. And so that starts to result in very subtle changes. And as we look at some of the changes that take place, that's when many times families will look back and go, wow, they've been doing that for years, and I wasn't making the connection that that was some type of dementia. So here's the slide on depression and vascular dementia. All of us throughout our lives go in and out of what's called situational depression. That's normal. We go in and out of situational depression and situational anxiety. We've all had a lot of situational depression and anxiety this past year, where something happens and it just is a natural, normal response to have some depression. But we use our skills, we use our tools in our toolbox, and we're able to work ourselves out. We pull ourselves out of the depression and the anxiety. That's not doing damage to our brain. Type of depression and anxiety that actually starts doing damage to our brain is when it is very long-term and, again, untreated. So depression and anxiety are the most common mood disorders in the United States. As a licensed counselor, these are two disorders that you'll see over and over and over again that people tend to have almost a shame attached to it, where they don't want to admit it. They don't want to talk about it. They feel like, well, if I were just stronger, I should be able to. Everybody goes through situational depression and anxiety. The latest statistic, and I've just found this yesterday, is that only 1/3 of those that are suffering from depression and anxiety are receiving any type of treatment. And that can be anything from cognitive behavior therapy with a therapist to having to take an antidepressant or an anti-anxiety. There's nothing wrong with that. Anxiety and depression damage the brain, and this is why, because when somebody is chronically depressed, now this would be something like a major depressive disorder or an anxiety disorder, it actually changes those chemicals in the brain. And what they have found is that the chemicals that are changed are the ones that are at the hippocampus. And we know that the hippocampus is the memory center of the brain. So there's the connection between dementia and depression. So another area damaged by depression is that conflict resolution center of the brain, and then also the prefrontal cortex, which is associated with planning and executive function. So the prevalence of vascular dementia. It is the second most common type of dementia behind Alzheimer's disease. And again, we talked about Alzheimer's disease last week. We know that Alzheimer's disease, you can find statistics on Alzheimer's disease that say anywhere from 60 to 80% of all dementias is Alzheimer's. It's the most common type of dementia, vascular dementia being right behind it. Statistics that I looked at yesterday, the newest statistics for 2020 said it accounts for 20 to 30% of all dementias, keeping in mind that vascular dementia, many times the person also ends up with Alzheimer's or Lewy body or another type of dementia. So 20% of people who suffer a stroke will develop vascular dementia within 6 months. The extent of the brain damage influences the severity of the dementia symptoms. So they actually have rehab for stroke, where somebody who's had a major stroke can go and do some rehab and be able to regain a lot of what they lost. That is where we need to continue to watch them, though, because with this statistic being 6 months, that's a little further out from the stroke. So they may have the stroke, but we don't really start seeing these symptoms of some of that permanent brain damage until about 6 months out. So some things that we can do to protect our own brain. This is the one dementia of all the over 130 different types of dementias that we actually have some control over. And we're thinking that research is showing that by doing these very same things that we can do to help protect ourselves against vascular dementia, that it may help protect us against other types of dementias as well. But this is the one that we absolutely know we have some control over, because we do have some control over our blood pressure, depression, anxiety, diabetes, cholesterol, smoking, those type of things. What do we drink? What do we eat? So with a good diet and exercise habits, as well as taking all of our medication as prescribed for all of our cardiovascular issues, we can have some control over vascular dementia. By stopping smoking, if somebody smokes, to stop smoking, limiting alcohol consumption, maintaining a healthy weight, and avoiding general anesthesia as possible. It's always very important to talk to your surgeon, your anesthesiologist, to have the least amount of anesthesia for any type of a procedure. It is general anesthesia that we know accelerates dementia. Twilight, not locals, but general anesthesia where you have to be intubated. So some symptoms of vascular dementia. And again, vascular dementia is going to vary widely because it depends on the severity of the blood vessel damage and the part of the brain that's affected. So somebody who has had multiple TAs, or those little small strokes, may appear and present completely different from somebody who has had a big major stroke. And the other thing with vascular dementia is that memory loss may or may not be a significant early symptom. If the part of the brain that controls memory is not the area where there is some damage, it may present with and not have a whole lot of memory loss. When they do have memory loss, it usually is recent or immediate recall, is what most families will see. So the most common symptoms that present first with vascular dementia can just start with things like, and you can see with these where we might confuse this for something else: confusion, disorientation, just trouble speaking or word finding. Physical symptoms like having some trouble walking, having headaches or numbness or even paralysis. And you can see where those link directly to strokes. And then other areas, and we talked about that prefrontal cortex area of the brain where planning and judgment are housed. And then here's another one that is unique to vascular dementia. Excuse me. There's commercials about this now because people are finally starting to talk about uncontrolled laughing and crying. And it actually has the name there that I'm sure I will mess up: pseudobulbar effect. It's also called emotional incontinence. And it is where, for no reason at all, they'll be laughing and then you'll look over and they may be crying. And then again, or they may laugh at things that are not appropriate to laugh at, or cry at times that are not appropriate to cry. And many times this is one of those signs or symptoms of vascular dementia. They have now created a medication that can treat that particular symptom, because all of these medications that are out there on the market, keeping in mind they don't treat dementia, they don't treat memory loss, they treat symptoms. But there is a medication that treats that particular symptom. But that does tend to happen many times with vascular dementia, where they kind of lose control of their emotions. The declining ability to pay attention, impaired function in social situations, that can go back to that emotional incontinence, where they just aren't maybe in a social situation, they may be saying or doing things that they have never done before. And then the difficulty in finding the right words, the word searching. Symptoms can remain stable for a period of time until the next cardiovascular incident. So people who have vascular dementia can ride those waves of being on a plateau for a very long time. With vascular dementia, lots of times you'll see that plateau last longer than it does with other types of dementias. Where with Alzheimer's disease, we always have that plateau progression. Vascular, sometimes those plateaus last a long time, but when they do turn that corner, it can be major. They can literally go from kind of being at that mild stage to that moderate stage overnight, because they've had another series of TIAs, they've had another stroke, they've had a heart attack, something along those lines. So the progression is a little bit different. So how does one get diagnosed with vascular dementia? Of course, the first thing we always want to do whenever we're suspecting anything is to first go to a primary care physician, have complete blood work done, make sure that this isn't a thyroid issue, that this isn't malnutrition, that this isn't depression that isn't treated, that this isn't high blood, something along those lines that can mimic dementia. Once we've gone to the primary care physician, they very likely are going to send you to a neurologist or a geriatrician. And that's where you have some neurocognitive testing. And in neurocognitive testing, they really measure all of the brain functions. And it gives you a snapshot of that day of where they are as far as memory loss, attention, being able to process information. The other thing that they're going to do is a MRI. And the majority of the time with vascular dementia now, they can see it on an MRI, because they can see strokes and they can see vascular changes on an MRI. And with vascular dementia, you don't normally end up having to have a PET scan or a CAT scan further. They typically can see it with MRI. So what are the latest outcomes? And again, yesterday I was pulling up the most recent statistics, and I went on Health Grades. And Health Grades is a website where you can go and get lots of statistics on life expectancy. Life expectancy, if diagnosed before the age of 65, is about 3 years. If developed after the age of 65, it's about 5 years. Now, many of you are maybe going, wait a minute, my loved one's had it for 8 years. They've had it for 12 years. This is a statistic. This is just the norm. This is the average. There's all kinds of comorbidities that come into play. It's common for people with vascular dementia to die from a stroke or a heart attack. In fact, the majority of time they do. They don't normally go to end-stage dementia, because they typically will pass away before they get to the end stage, because dementia is terminal, but most of the time someone dies with dementia, not from dementia, and that's particularly true with vascular. And then life expectancy is a little bit lower with vascular dementia than other dementias because of those underlying vascular issues. So treatment. There are no approved drugs specific for vascular dementia. There's no approved FDA drugs approved for vascular dementia, or any other dementias for that matter. We have the Namendas, we have the Aricept. Those treat symptoms. All of the medications treat symptoms. So what can we do for treatment? What we can do is we can control those risk factors that we talked about. Even after the person gets diagnosed, I found this on the Alzheimer's Association website, that last bullet point, there's substantial evidence that treatment of risk factors may improve outcomes and help postpone or prevent further decline. So if when the person gets diagnosed or we start suspecting that we have vascular dementia going on, we start taking care of, we get on those medications, make sure we're taking our medications like we're supposed to, change our diet, change our exercise, stop smoking, stop drinking, get our weight under control. With this type of dementia, they're showing that we can postpone or even prevent further decline. Controlling risk factors that increase the likelihood of further damage to the brain's blood vessels is an important treatment strategy with vascular dementia. Again, the one we have some control over. So some things that we can see with vascular dementia, early stage care, what we want to do is with all the dementias, we want to focus on normalization, especially early in the disease. We want to start with those simple reminders, the structured routines, simplifying their tasks, but allowing them to still be an individual and to still have dignity and to still take care of themselves as much as they can, as long as they can. We want to focus on normalization early in the disease. So we're going to provide cues for recall. We're going to provide cues for context. We're not going to just jump in and take over for them. We'll start to see behavior and personality changes, and those can be some of the most difficult things that we as family members deal with earlier in the disease. Again, as far as memory goes, it's usually loss of recent events, including immediate recall. And that's why lots of times when you're seeing someone tested, they'll give them 5 words, repeat these 5 words, and maybe 1 minute later, they ask them for those 5 words. That's called immediate recall, and then ask again in 2 minutes or 5 minutes. The ability to interpret words, where they're hearing the words, but they're not able to figure out exactly what you're saying. And then they may start to miss some words. You may see them starting to get off task easily, where they're doing something that has some sequencing with it, like our activities of daily living, getting ready in the morning. There's a lot of sequencing to getting ready in the morning, and you'll walk in and they may just be standing looking. What do I do with all this stuff that's here on the bathroom counter? A loss of awareness of their body and their body position. The ability to locate and express pain. You may see that early in vascular dementia. We mentioned sequencing, fine motor skills. Initiation of anything where we have to encourage or prompt or cue them to get going, to start eating, to get dressed. And they may not be able to make their needs known early in the disease. So the mid stage of vascular dementia, we call this more, with all the dementias, supportive. We're going to come alongside them and support them. So now it's a little more than normalization. We need support. Support becomes vital not only for the person with dementia, but also for the caregiver. And this is where many times families start looking into some respite care, adult day programs, and support groups as they realize how this is affecting their life and their loved one's life. And they're going to start requiring more direct care, more hands-on care. So this is going to be where it's important for us to start reducing their distractions. Make sure you're not talking over them, include them in their conversations. And again, you're going to get all of these slides. So we're going to send these out to you. I know I'm going fast. We're going to really make a point there in the mid stage of the disease to start to slow down when we're talking to them, using those 3 to 5 word sentences, not using as many adjectives, watching our tone, our body language, our gestures, because they are still going to be able to read all of those in us throughout the course of the disease. Asking one question at a time, making sure they're yes and no questions. Looking at their behaviors and realizing that every behavior is communication, and trying to figure out the feelings and emotions and the needs that are being expressed. What need is not being met as to why they had that behavior? They're not giving you a hard time, they're having a hard time. They're struggling at this point. They're having a really hard time. Repeat back to them what they're saying for clarification and for validation, continuing to use visual gestures and cues, and then don't pull away from them during this time, this middle stage of the disease, really trying to nurture your relationship and make sure that you're getting time where you're not just the caregiver, but you're also still the spouse, or you're still the adult child, or the parent, or the friend. And then in late stage care is normally what we call a sensory time. This is a time where specialized care is necessary, where you're going to end up either you may have to place your loved one, or you may end up having to have some help come into the home. In late stage care with vascular dementia, they are needing around the clock care. They can't be left alone. They're needing help with all of their activities of daily living. Severe language breakdown. They may only have less than 10 words. And then a lot of difficulty making their needs known. Hard time understanding speech, so we continue to use a lot of cues. And their actions are their main form of communication because they have lost their language at this point. They may have a very difficult time recognizing people, but they know you're someone important. They will always know that you're someone important, even if they do not know your name anymore. And they may sleep a lot of the time. And even when they're awake, just kind of be alert, almost be dozing the majority of the time. We do have I'm looking to see how much time I've got. Oh, it's right at 11:30. This is about a 3-minute video. Jamie, should I go ahead and show it, or just, what do you think?
Yes, I'm getting some nods of it. Yes, go ahead and
Okay,
show it.
okay. So I've got to stop sharing and then start sharing again. It's just 3 minutes because I forgot to share my sound. So let me show this, and this is a great summary of everything that we just did. And again, you'll get the link to this. Jamie, if you'll give me a thumbs up if you can hear and see.
What is vascular dementia? Vascular dementia is the second most common type of dementia. It is caused by problems with the blood supply to the brain. Nerve cells require oxygen and nutrients to survive. Without them, they will become damaged or die. Cells are provided with oxygen and nutrients by a network of blood vessels in the brain. When the blood supply to the brain is interrupted, for example by a sudden blockage or a leak, this is called a stroke. A stroke can cause significant damage to parts of the brain. When the parts of the brain responsible for memory, thinking, or language are damaged in this way, a person will have difficulty remembering things, thinking, or speaking. These are all symptoms of vascular dementia. Sometimes, a single large stroke is enough to cause the symptoms of dementia. This is known as post-stroke dementia. This scan shows damage to the brain of someone with post-stroke dementia. In other cases, a person may experience a series of smaller strokes that gradually cause damage. This is known as multi-infarct dementia. Following a stroke, a person's symptoms may remain constant for a while. Then, if the person has another stroke, they may notice a sudden worsening of symptoms. This is known as a step-like progression. Small vessel disease is where there is a narrowing of the blood vessels deep in the brain. Small vessel disease is the most common cause of vascular dementia. As the narrowing affects more small blood vessels, and more of the brain becomes damaged, the person will experience a gradual loss of abilities. Usually, people with small vessel disease notice a slowing of thinking and problem solving. For example, taking longer to think of a word and write it down. Evidence suggests that lifestyle factors that promote a healthy blood supply, such as regular exercise, not smoking, and eating a healthy diet, could help to reduce the risk of vascular dementia. There is currently no cure for vascular dementia. However, by controlling underlying cardiovascular diseases which affect the blood supply, such as high blood pressure, high cholesterol, and heart disease, it may be possible to slow down the progression of the condition. Vascular dementia will affect people differently, depending on the parts of the brain that are affected. However, a common symptom is having problems with planning and organising, or with concentrating. It can help to break complex tasks down into smaller steps and to make sure that environments are not too busy or noisy.
I thought that was a good summary of everything. And you may have noticed that site was called the Alzheimer's Society. It is the UK's answer kind of to the Alzheimer's Association that we have here. They have some really good videos, and their website has some fantastic information if you're ever just wanting to look for some things. Again, we will send you out this the slides, and we will send out the recording. Jamie has just put up a poll. I'm glad you remembered to do that. And she is asking, how did you hear about today's bite-sized programs? If you would please answer that. It says, did you hear about it on Facebook, on an email from us, referred from a friend, our website, or other? That is pretty cool how that works. Does anybody have any questions while we're doing that? Questions or comments about vascular dementia?
I have a question about the when they stop recognizing loved ones,
Mhm.
and you said they still think it's somebody important. How does that work?
We know that their amygdala is intact. That's with all of the dementias. The amygdala stays intact, and the amygdala is what holds our feelings and emotions. And so being able to, they've been able to show this, that being able to know that that is someone who loves me, who cares about me, who is here for my good, that that part stays intact. One of the things that they may start to do is we go back to who we were originally. And originally, we didn't have children and we didn't have grandchildren, but we always had a mama and a daddy, or we always had a brother and a sister. So they may start thinking that an adult child is their parent, or that an adult child is their brother or sister. And that again is going back to where were we originally safe? Where were we originally taken care of, and who loved us? And in most people, they will go back to thinking that they may even call caregivers mama. But we know that that feeling of safety can stay. Or on the other hand, that's why it's so important that we watch our tone and our body language, because they can still read it. Even when they have that flat affect, when they can't show their emotion, they can read ours. And we know that because the amygdala is intact. They've been able to show that over the last several years in autopsies of people who've died with dementia. Kristen, you are muted.
Oh yeah, here we go. So, so mom, I'm almost certain has vascular dementia, although that they didn't really tell us what kind of dementia when we got tested. And but most likely it's that because she has a hypertension, because it came on suddenly. In May she was balancing her checkbook, in June she couldn't at all. In fact, she was wandering around the house screaming at that point in time. I mean, it was just such a huge difference. She was taking college classes in March, and then in June she wasn't, you know. So there was definitely that step, right? The step down. And since she's been in our care, thank heavens we brought her here, and we've been nurturing her through all the different resources that we've been able to utilize. She's got control of her diet. She's got control of her depression. She's got control of her hypertension, her high cholesterol, all of these things. So she never smokes and she doesn't have obesity, but a lot of these things that were contributing to this factor is just her diet, her exercise are all great. And in fact, she's had great diet and exercise for years before the incident happened. This was, this was definitely a depression episode that brought this on, an anxiety episode that brought this on. So I don't know, that 5-year thing feels so like, if we've got all of those things being controlled, are we really going to see mom continue to have, I mean, if she never has another drop, am I still going to see a gradual that I know that it's breaking my heart, right?
I know it. I know it. It is, and that is one of the hardest things with dementia is that they are all terminal once they're diagnosed with it. But again, please don't let that number hang there because it is so different with everybody. That's just the statistic. But you're doing all the right things by keeping us. The reason that the life expectancy is so much shorter is because most people don't get those things under control. They just continue, they either don't know to do it or they just continue with the lifestyle that they've had for the last 60, 70, 80 years because it's hard to change something we've been doing for a lifetime. So, that's what you can do. You're doing the best that you can. You're getting under control what you can get under control.
And then I had one other question. When we were talking about the difference between early and mid, so I was giving mom the care of mid when she first got here because she really was more had symptoms of the mid because of the depression, because of the anxiety. So she was still kind of a lot more confused, a lot more lost. Now that we've got a lot of that under control, because it's taken a while. It was a deep set depression. It was not something that was just going to go away without treatment. And so now we've had a year and a half of treatment. We're starting to see her be more reflective of early. So I've taken a lot of steps back of not being supportive anymore and letting her just do it by herself.
Right.
And there's this toggle of I feel like if I don't know, I want to spend time with her, but I feel like if I spend time with her, helping her, which is what she desires, then we get back into the mid.
Yep. Well, and but with vascular, again, it's one of those that as you do those things, you're getting the diet, you're getting the medication, you're doing those things, you see them hit that plateau and it almost is like, I've had people even say, they're better, they're getting better. Because that's with this dementia, we can see them hit those long plateaus. So you're doing exactly right. We'd moved into supportive. We're going to back off now more into the normalization, where normally we'd be going, okay, we're going to do normalization, supportive, sensory. Where with vascular, when they hit those long plateaus, it's just where you're always on your toes, though, so that you can step in if you see her really struggling, because you also don't want to trigger a depressive episode or trigger an anxiety, where you may have to step in and, okay, we're going to be supportive for this incident or for this day even, or for this morning, but tomorrow we're going back to normalization.
Okay.
So it sounds like you're staying on top of it, but you are constantly on your toes.
It's one of those things that it was really hard. Like I said, I mean, a lot of the progress that we've made actually since October was a result of her caregiver getting COVID and not coming to the house. So she had to do it on her own. And now she is doing it on her own. So
amazing.
I feel like I shouldn't be helping her with that, but I want to enjoy spending time with her, but maybe not doing chores with her. Maybe you're right. Maybe we just need to find something else other than chores to do.
Right. And let her do as much of it as she can that she wants to, so that you're not pressuring her to do it.
Right?
Great.
I tell you the other day, I'm the great manipulator, right?
I was looking in our chat. Ricky wrote, let's see, she has had TI strokes verified. She's had vascular for many more than 5 years. And we do hear that over and over again, especially whenever they do get those cardiovascular issues under control. She's progressed to what showed for late stage. I think he has Alzheimer's as well. And you may see that. And it really, because families will go, do we need to go get diagnosed if they have vascular and Alzheimer's? Is that important? It really isn't. They're going to treat it the same way. It's not like, oh, they've also got Alzheimer's, here's this magic pill. There's not. They're going to treat them the same way because there's not that, unfortunately, there's not that memory med specific to anything. All the doctor's doing is treating symptoms. So yes, especially Ricky, if you've seen a long plateau and maybe now she is more at the moderate to late, it may very well be that they've got that dual diagnosis or mixed diagnosis. It's very, very common for them to start out with vascular and end up with vascular with Alzheimer's.
Holly, I had a question real quick about
Sure, Caroline.
from the video. They talked about the significant role of small vessel disease and vascular dementia. And my question has to do with the MRI, which is always part of the diagnostic process. And that is small vessel disease something that might not show on the MRIs?
Exactly. Yeah. Just like TIAs many times don't show. I don't know if y'all noticed whenever they showed that picture of the damage in that video, you could miss it if they didn't have that arrow pointing out. And that was a major stroke. And it was a tiny spot. So that's why so many times those TIAs are called pinpoint strokes. They don't always show up. So that's where you get a really good doctor who can do kind of a process of elimination and really take a thorough history of behaviors that you've been seeing, changes that you've been seeing. But you're exactly right on that small vessel. It does not always show up. Now, sometimes they'll go back and they'll do an MRI with contrast. And when they add the contrast, sometimes that it will show more than a regular MRI. And if they're suspecting it, many times they'll order the MRI with contrast early, where they put the dye through, IV dye.
Interesting. You always learn something. I thought, you get your dementia and that's the dementia you have for the duration. I didn't realize vascular could turn into Alzheimer's.
And what it is it's vascular, and then you also develop Alzheimer's. So you have both. Yeah, sure can. Well, we appreciate everybody staying on with us. We appreciate all of the questions. And again, if you come up with any other questions, you've got our emails. Our emails and our phone number will be on that last slide whenever you get your slides today. Next week, Jamie, we're doing Lewy body. Is that correct? We're going to do a 30-minute program specific to Lewy body dementia, if you're interested in that. A lot of times we're just interested in finding out about the different types of dementias. We'll also be doing one specific to frontotemporal. We'll be doing one specific to Parkinson's dementia. We're going to do one specific to alcohol and drug induced. So, and again, if you think of any other topics that you'd like to have one of these programs on, please shoot us an email. We'll put one together for you. Well, thanks everybody. We appreciate your time, and we'll get this video and slides out to you this afternoon.
Thank you. It was very helpful.
Thank you. Bye-bye.